नमस्कार दोस्तों, मैं अमिताभ and you are watching A Word with a Word on the School Times web channel. Entertaining, educating, and empowering. And as you all know that every Saturday 4 p.m. you have a date with us on this channel for our show A Word with a Word, where we have a dialogue with people on various socially relevant issue and try to get a perspective from people who have experienced that field, that concept, that context. And today is no different, and we are here to have a dialogue with a word on COVID-19. But then we are not going to talk about what is the treatment and other aspect, because there's lots being talked about, lots being said about. There are a lot of appropriate authorities giving us the information about the same. We are here to share experience of COVID winners. And friends, when this whole thing has happened, what we realized that people from different walks of life, the social media was a buzz. Everything, every possible thing has been said and shared about COVID-19, the treatment, the allopathy, homeopathy, Ayurveda, naturopathy, every aspect has been talked about. Then whether the surface contact is going to spread the infection, whether people contact is going to spread the infection. So many things being talked about, and I would once again reiterate and re-emphasize right at the onset, please go to the appropriate sources to get the information. Don't be misled by the informal sources about these information. But then there is one more aspect of COVID-19 is, one is the fear of COVID-19 and the anxiety revolving around it. People who have gone through the experience will be the right people to tell us, share with us what is it and what it takes to go through that phase when, from the time, I would say COVID has various phases. Phases when we have nothing to do with it, we're only aware that it is a possibility that we may get infected and we are worried, we are taking all due caution and precaution. Then comes a time when we get those symptoms in us and we get the anxiety, we get the worry that am I affected with it? Because we are hearing all kind of news around, and I know people have suffered to the extreme. We have our deep sympathies. But then there are people who have come out of it. The survival rate is much higher than the fatality rate. It's about 2.5% or so where people are succumbing to it, and the comorbidity is being said to be the major reason with it. But then the anxiety and the stress that one goes through that period of time itself affects our immunity, affects our will to face the challenge. And I, as your friendly psychologist, I have a belief that even in COVID times, when you're going through that phase, it is your attitude that is going to decide the success ratio in your battle with COVID-19 when you are diagnosed till the time you come out of it. And friends, I am no authority on that. The right authority are the people who are winners in their own respective spheres of life. They're great family men. They have family, vouchers with their name. They're great professionals in their own respective industries. They have created extraordinary name. That itself was good enough for me to understand that they have just the right attitude towards life in every aspect. And then I came to know that they have experienced COVID. They have gone through. They were diagnosed COVID positive at different point of time, and they have there also they have taken it with their right attitude, faced it with the right perspective. Not that they have not gone through their share of anxiety, fear, and the stress, but then they have tried to deal with it. And today, I'm joined by three people, and we have with us Mr. Ashok Bhuta. Ashok Butta, is a very lively individual. Takes, has a jest for life. In fact, all three panelists of our show today are full of jest for life and very spirited. And Ashok Butta is a director of one of the leading dental houses in Calcutta, that is Dental World. And he's also charter member of TAI chapter of Calcutta. Then we have Shravani Chakrabarti. Shravani Chakrabarti, again, if I talk about our second panelist, Shravani Chakrabarti ji, she is managing director of Support Act Enterprises Private Limited. While talking just before, all of them are connected with us right now in the virtual studio of the School Times, waiting to be called upon on the screen to share with you and their experiences. She has already done more than 600 ad films and documentary films. She's a creative director. They are into digital marketing, and she has very kindly agreed to share her experience because she's right now recovering and coming out of it. And even in this phase, she said, no, if it is about sharing experience, and if that can help people, I would like to be the first one to be up there. She's also charter president of the only all-ladies Rotary Club of Calcutta and West Bengal, that is Aviana. So she is also here with us to share her experience with us. I have my fellow Rotarian, past president, Mr. Rakesh Bhatia. In our club, he is known for his liveliness, his spirit, his cheerfulness. And we have seen that even when he was going through that phase of being diagnosed COVID positive, and I would call him up and speak to him about his well-being, he said, "Yaar, maza aa gaya." That is how he would, he would maintain that spirit of positivity and attitude at that point of time. Mr. Rakesh Bhatia runs a very successful Promises Marketing Group here in Kolkata, and very, very avid Rotarian, and recognized for his contribution at district level, also in Rotary Club of in District 3291, Rotary International District, Calcutta. And so we have these three panelists with us. So, ladies and gentlemen, I'm your friendly psychologist, Amitabh Mohan, and you are watching The Word with a Word. And our theme for today is COVID-19 virus. Fight it, don't fear it. So let's invite our panelist on our main screen. Namaskar, Ashok ji, Shravani ji, Rakesh ji, for being with us today to share your experiences. Welcome to the School Times.
Namaskar.
Namaskar.
Namaste.
So, first of all, congratulations for braving the time that people fear the most in these last 8 months. We all have, people who have gone through it, come out of it, people who are going through it. Initial phase, we have been talking about statistics, aaj itne, kal utne, and gradually our hope towards survival percentage has gone up because India has done well in coping up with the pandemic, and survival rate is good. But then all three of you have gone through the experience. And today we would like to give that first-hand account to people about your experience. And I would like we would like to keep our panel discussion format. I would like 1 or 2 minutes, each one of you share your experience, and then we will take our discussions forward. And I would request Ashok ji to kindly enlighten us with his experience.
Thank you, Amitabh. I'm Ashok Butta. I've been introduced very well by Mr. Amitabh Mohan, so no need to get into that. Before I tell you my story of getting infected with COVID-19 and the subsequent treatment and how I'm dealing with it as of now, I would like to give you a brief understanding of my uh, of myself about this COVID-19. So, like any other infection, COVID-19 also needs to be recognized. If you don't recognize the COVID-19, then you will not get treated, because most of the treatment today is symptomatic. Nobody knows the nature of the disease, and therefore, even the most experts of doctors. I'm handling a pharma company also, the largest pharma company in the country. I'm the principal agent in West Bengal. So
Right.
I know that none of the doctors have really an idea of how to treat this particular. Everybody's waiting for the vaccine. The most important thing is to recognize the disease, okay, and treat it symptomatically. If you have fever, take fever medicine. If you have headache, take headache medicine. If you have a diarrhea or anything else like that, so the you get in touch with your doctor and get the treatment done. Don't allow it to linger on. In my case, what happened? I allowed it to linger on. I
Okay.
took, I took initial, household medicines, and then 2 3 days passed. But I never contacted a doctor. So when
Okay.
the fever was persistent, and the cough was there, also dry cough. So I got little panic, because you see what happens. Initially, you feel how you can get COVID. It is not possible. How you can? You will always in a denial mode. People who have such experiences as running nose or headache or diarrhea or fever, they must immediately contact their doctor and
Right.
tell them about the symptoms, and also about the comorbidity. Like suppose if you have blood pressure, or you are having diabetes, so you must disclose all that to the doctor and get a treatment. Maybe he will not be able to help you much, but most of the people who get infected by COVID, they get treated also at home. Not everybody is going to hospital. But my advice to everybody is that anybody who's above the age of 55 must get admitted, because
Right.
at home treatment is a little tough. Here
Right.
the role of the here I would like to emphasize the role of the family.
Right.
When you are infected with COVID, nobody is going to come near you. Not
Right.
part of your family will be brave enough to come and treat you, but everybody will
Right.
distance themselves, which is very obvious. Hmm. So it is the duty of the patient, as well as of the nearest in the family, to see that further people don't get infected. So the role of the family is very important.
Okay.
Here, huh, mostly it is the wife or the mother who is in touch with the patient, and as per the doctor's advice, they give the home treatment. But if you
Right.
find that the treatment is not working, immediately shift the patient to hospital.
Right.
We have faced some very fatal situations in our building only, where the treatment was delayed and the patient passed away. He's our past a member in the Rotary Club of Kolkata.
Right.
So I leave it at that. Then I'll take it forward after Rakesh has.
No, that's thank you so much, Ashokji, for sharing your experience and few very important point that you pointed out. One is that the medicine is yet to be found. We are
Hmm.
optimistic about the vaccine and other factors. So doctors are going symptomatically for treating, and very important to identify it in good time and not to linger. Get connected to your doctor in good time so that you get the care at the right time. That's a very, very important point. And then very important point that we would like to discuss further is role of a family, because it's how the family takes up the whole situation is a very important factor in the complete healing and the cure of COVID-19 is a very, very important context. And it's not just about, as you emphasize, healing and the cure, even the security and the safety of the family members becomes equally important in the context of COVID-19. So thank you so much for sharing that. I now go on over to Srabniji to kindly share your experience with COVID-19 virus.
Yeah, thank you, Amitabh ji. See, as I heard just now, which is very true, we all remain in a denial mode initially when we get to see some kind of a symptom, and the point is that it comes through some way or the other. Like in my case, I had a very late night bath, and I had shampoo, and I did not. Naturally, immediate after 2 days when had fever, I thought it's because of that and late night shower, and that's the reason I got fever. So nothing to worry. But one thing which I did was that, as Bhuta mentioned just now, that the moment I had fever, I consulted a doctor, and I took medicines. Doctor told me definitely that you need to do a COVID test, and I started requesting, is it important? And said, you just go, have medicines and just see how it goes. Well, he had given me very good medicine. One, I had a stomach issue also, and I had a bit of problem in my throat, not much, but I had fever. So with the antibiotic, when on the fifth day I got fever on Tuesday, and on Friday I thought that I should do a COVID test. Now it was in June, so that time COVID test was not that easy, and there were a lot of taboo during that time, and it was on the initial days. So I was also very scared, and but I had a very supportive family who, and then by the time I called up, it was the COVID. I mean, they came for the test. It was Monday, and on Saturday, actually, I my fever went off. So, the strange part is that after Saturday, I was asymptomatic totally.
Okay.
Now, the question is, people told me, why are you going for a test? Because it's you don't have fever anymore, and you don't have any symptoms. So, but I
Right.
thought that let me go for a test, because once I have decided, let me go for a test. So
Right.
on Monday, I did the test, and Tuesday, I became positive. Now, what is interesting over here was that when I had fever and I did not know I was a COVID patient, at that time, I was quite normal, watching televisions, reading storybooks when, throughout the day. But the moment I got to know that I'm COVID positive, I could not concentrate on anything. So it is more of a psychological pressure, which actually comes on a patient. The fear of isolation, yes, because in my case, my family was trying to, because I was in a different apartment totally, and third floor, and I did not allow anyone to come. They wanted to come and give me food, but I was very, very strict because I did not want to infect anyone. So I
Right.
went for you. But the strange part over here is I went for total isolation after I got to know I was COVID positive. By then, 7 days were already over, and I was in
Okay.
at home under supervision of Medica. And so what I could realize is that it's the psychological aspect which actually envisages you totally. So that is where one has to really be very, very strong, and in whichever way I feel, whichever way you want, whatever is your belief, be it chanting, be it meditation, be it, I would request people, to get into that. If the symptoms are not that severe, if you are not, I asked the doctor once. My oxygen level was quite low, in a sense, 92 it was. The doctor said, "Are you having any symptom?" I said, "No, I'm not having any problems." Said, "You please relax and be there. If need be, we'll take you. We'll bring you over here." So tremendous doctors were also very supportive, and so that phase I felt that uh, I was very scared of government coming and sealing my apartment, and people would start looking at me, because that is the time where COVID patients used to be, just like an zoo animal. People used to just look at those houses, and it was of terrible pressure. And I
Right.
could share, because whoever I thought that let me share, I could hear, I could see a lot of taboo in their mind. Oh my God,
Right.
uska dekho COVID hua hai. You have to be very careful. So this was the attitude over there at those days. So,
Right.
however, I feel that it is, I mean, you require a lot of mental strength, and
Right.
you have to constantly see what are the symptoms you have, whether it is increasing or you are really having some discomfort. It is that point of time you have to be very open with your
Right.
doctor and tell him that these are the problems I'm facing. And if
Right.
need be, you have to be hospitalized. I know hospital, going to the hospital, being again in isolation over there is a pressure, but we need to see, and we need to face it and see that yes, I have to take it up and I have to solve this issue. So
Absolutely. So we need to face it, take it up, and solve it, and
head
that
on.
is the attitude we need to keep. And you quite rightly said, and I would like to emphasize here, friends, those of you who are viewing us right now in a live mode, and those who will view us later on in a recorded mode, because we'll be available thereafter as well. Uh, you must be realizing that the panelists that we have today, who are so successful in their life and they have succeeded, they are not saying that don't worry. They are also people who have gone through a phase of worry. They are the people who are as human as you and I are, and they are not asking you to be do anything extraordinary. They are saying, I also got worried, I also got anxious, but then that I have, Srapniji says that she has gone through that phase of psychological stress and anxiety, and but then very soon she realized she has to fight it out, she has to brave it up, and that attitude helped her out. And being open with the doctor, being timely about it, is once again reiterated. Srapniji, thank you so much for sharing that and having such positive attitude towards life. I think that's one important tool at the moment, which is going to help everyone make doctors' efforts work with them. And with that, I come to my, evergreen, laughter is the best medicine attitude friend, that is Rakesh Bhatia. He keeps on, he's one person who can crack joke on almost everything. And I think he has cracked n number of jokes, even going through the pandemic phase. I called him up while he was going through the phase, and I said that if you can call me up, अकेले होगे तो बातें करने को कोई नहीं होगा, तो आप मेरे पर you can let me know. We can virtually always get connected and have some good word. And even at that point of time, it was me who was supposed to cheer him up. It was he who was cheering me back, rather saying, "Don't worry, all will be fine." Rakesh Bhatia, with that attitude, can you share your experience, Rakesh Bhai?
Amitabh, thank you so much for taking up this risky topic, I would say. People, if they have COVID, you heard about heart attack. A heart attack, just one person in the family suffers. But in COVID, the day the results came, COVID! I mean, not with me. The whole family got the attack. COVID! Ho gaya? Arey yaar, what the hell? Yeah, as it is, I am sinking. And then you all say, ho gaya. I mean, delivery. So that was the worst part of COVID patient, COVID hua, koi baat nahi. It would have been like that. Yeah, it's okay. Yeah, if something has happened to you, we're all there with you. But the way the attack came, anyway, God's been merciful. That's all I could say. God's been merciful to all of us. And me. I believe, the gods were having a meeting sometime upstairs or wherever they are. And they were
Right.
saying, the world is going bad to worse. Let's teach them a lesson. Let's give them a break. Let them understand that they are running where? What are they doing? Everyone has become so selfish. Everyone thinks he's the boss. He's got the money. He's got the power. He's got this. He's got the connection. Let's give them a lesson. So one God said, he said,
Right.
let's have a World War III. The other God said, "Nahi, yaar, World War III बहुत ज़्यादा हो जाएगा. It becomes a strain for us also. Give them some small dose." So they released this thing called COVID-19 virus. Now someone had to release it, so some state, some country has been blamed for that. I'm not going
Right.
into that. But then ultimately, COVID came out. In fact, we should be happy, merciful that the World War didn't come, COVID came.
Right.
If you think about the old times, when we Indians were supposed to come back home, we used to wash our hand, leg, everything outside the house. This is what COVID is trying to teach us. This simple thing: be neat, clean, and be more hygienic. Don't bring your slippers home. Don't bring dirt home. This is it. Anyway, somehow Rakesh Bhatia thought he's a big hero. I'm being the secretary of my building, and I said, Nietzsche will put up this. I went walking outside, gave mask to a lot of people from Rotary, from this side, did everything, what possible. Took all the precautions in the world. But poor thing, that thing did not leave me. Somehow I caught it. How I caught it is a different story. But I learned one thing: all the money, all the connection, all the power fails in front of COVID. Trust me, friends, nothing works. When you get COVID, you remember nothing is there to help you. Yes, your family is with you. And the most important person with you is your life partner. I tell you, I will never forget my wife like this. I mean, she was there with me all the time. Anything you want, she was always there at my service. And still she says, you don't say I love you every day. I don't mean it. I confess it, yeah. When
I
I suffered,
really appreciate your saying that, because family plays a very, very important role in COVID recovery and dealing with COVID all the more. Because I think the recovery of COVID is COVID's choice, because nobody knows how it recovers as of now. But then dealing with it is our choice, how we deal with that phase. And that is where family plays a very, very important role. So thank you so much for sharing
you
your experience. Yes, Rakesh.
Yeah, Amitabh, the only friends who I saw visiting me was the birds. There was a crow every time during the lunchtime. I don't know how this guy used to come,
Oh, nice.
sit. I tell you, there were miracles which happened. God
Right.
is, and
You know,
these miracles are the ones who gave me the
Rakesh bhai,
inspiration.
this brings me to
Please.
I remember you sharing a video with us that you have while you were in a home quarantine, and you the window was your only access to the outer world. You
Right.
have shot a video from your room, and I would like to share that, and I would like you to share a story behind that with all of us. Here. Just give me a second as I share the screen with all of you here. Now, ladies and gentlemen, this is the video that has been shot by his mobile by our friend here on the screen, Rakesh Bhatia, while facing this COVID-19 home quarantine days.
You don't
Rakesh
come
bhai,
up
what's the story behind?
love. See, this is it. Two, not one, two woodpeckers. And this is
Right.
just exactly on the left hand side. My windows open there as if they have come to entertain me, explain me that, look, don't worry, we are there with you. I mean, I tell you, all these beautiful birds you hardly see, especially see, the COVID time also had good things. Birds, a woodpecker coming next to my third floor. This I stay on the third floor and doing this. This was wonderful. These were the inspiration for me to fight COVID out. Look
Third
at this.
floor of your building, and which is in the heart of the one of the most crowded cities of the country, that is Kolkata,
Yeah.
and
It's,
right in the middle and the heart of the city. So, Prince, if you see, uh, I was talking about the attitude of all our COVID winners who are there with us on the screen, and this is one of the ways that even at that point of time, their zest for life has not diminished. Even in that limited environment, Mr. Rakesh Bhatia was able to find his entertainment, his joy, even to philosophize on the, what the bird is thinking and what message the bird is giving. Everything was happening in those times, and that is how you remain positive towards your life. So thank you so much for sharing that, and allowing me to share this video that you have shared with us during that period of time. So thank you so much, Rakesh bhai.
thank you.
Uh, Now, this brings me, there are two kinds of people who are there at the moment in the world: haves and the have nots. Those who have suffered with COVID, and those who have not. That is how the world is divided at the moment. And now, those who have it, they're going through the phase. So you've already shared, you who have dealt with it. A lot of people are having that anxiety and that fear that agar ye humko ho jata hai to kya hoga. So I would like, as Rabni ji also said, each one of you in your own words have emphasized that mental strength is very, very important during this phase. So I would like, what were the fears that you have gone through? And how did you deal with it? What were the anxieties and how did you go about dealing with it?
अमिताभ, इश्क
जी.
इश्क आई वुड रिपीट दैट, इश्क एंड कोविड कभी भी हो सकता है, तो दोनों को
और शादी के बाद भी, इसीलिए 2 गज दूरी है बहुत जरूरी.
आई क्या बात.
All right. A light away aside, but then you are very right. इश्क और कोविड कभी भी किसी को भी हो सकता है. आपकी mental strength आपको बचाएगी. And that is where, Ashok ji, your thoughts.
Haji, you were saying people who have been infected with COVID, so they have gone through the ordeal. Those
Right.
who have been saved, and they have. I mean, we are told that every single person on this earth will get infected one day. So people who have not yet been infected, they are mentally prepared actually. कि
Right.
जब ये सब जब होना ही है तो होगा. But मेरा you see, I want to give a word of caution over there. So these 3 formulas which are being told by the government all the time, 2 gaz ki duri and your mask, and when you have a infection, be in isolation for some time. All those things, they are very, very important. At least why suffer today when you can delay it for some time? Why suffer? In the meanwhile, vaccine, if the vaccine is available, then life is saved. So this is one thing I missed out in my last session was post-treatment, life post-treatment.
Right.
That is also very important. People who have not yet been infected and people who have been infected,
Right.
the psychology of these 2 categories of people is entirely different.
Right.
People who have been infected, they are cautious. They want to tell others what they have gone through. Like, when I was in the hospital bed, each single day I used to look up at the ceiling and think, yaar, ye aaj mera raat ka last day to nahi hai. This was a type of fear. But having come out of the, treatment successfully, I today feel there was no need to fear. There was no need to fear. Provided you are being treated properly, provided you have reached the hospital on time, not too late, provided that you have a support of the family. So these are 3 things very important. People who have not yet got the COVID infection, they must not ever feel that they will not get it. They will get it. But
Right.
maintain your distance. Whatever the norms the WHO has recommended, you must maintain those norms. You can delay it. One more thing which I would like to say, your immunity after you get, even if you get treated, your immunity is already low.
Right.
So don't think that once you have got the infection, you are not to get it again. You can get it again also, because your immunity is low. And diet and exercise, these are also very important. So these are some of the and precautions. Other precautions you can take, like do not go in the crowded places. Do not conduct closed room meetings.
Right.
Don't attend club. Yesterday, was my birthday. I had gone to the club, and we sat in the open air thing. I came back. Look at my voice. I'm not able to talk much because of my. I got my immunity is low. Anything. If I exercise more, I get fever.
Right.
If I stay out for long, I get some problems. So so it's like that. So you have to take all types of precautions.
All right. That's very important, and it's a very. It's not easy for people who have not gone through that phase to imagine the kind of fear and the pain and anxiety one goes through. Like you quite rightly worded it, that every evening, every night, you would look at the ceiling of your hospital room while you were hospitalized, and this thought would cross that, is this my last day? And there cannot be a bigger fear and anxiety that one can have, that will I see the sunrise tomorrow? And that is no ordinary anxiety. And but then, as you quite rightly said, that but at the same time, it is important to maintain that optimism and uh, keep that hope, because once you've gone through that experience, you very quite rightly emphasize that the few things which those who have not gone through it, those who have not gone through that experience, probably will not realize. ये जो गवर्नमेंट दो तीन प्रोटोकॉल कह रहा है, what government is emphasizing कि मास्क लगाना जरूरी है, घर से निकलिए तो मास्क लगा के निकलिए, keep that physical distance from people, and be timely about connecting with the medical help. If you are doing that, you have every possible chance, and that's what you're saying after having gone through that experience and pain. So I would take this liberty and address all our viewers. Please, please, please do not take these guidelines. It may appear very simple, that wash your hands, put up the mask, and you know um, be vigilant about your health and be in touch with doctor. These may sound very simple words, but these are the lifesavers for you at this point of time. And this is not what I am saying where from having read it from the books. This is the people who have seen it all, gone through it all. And very important point, Ashok Bhai, you have mentioned is post COVID. Don't, I've seen some people having gone through the COVID experience and then suddenly say, "Ab to mere ko ho gaya hai, to I'm immune." Please do not live in that utopia, because after post COVID, your immunity is weak, and you are vulnerable not just to COVID but many other things. Secondary infections
Many
are
other diseases.
also a possibility, and that is why you need to be careful. So follow all the guidelines the WHO or the doctor provides you, even after you recover from COVID. As long as doctor says now it's all right, you can be doing things at will. Please maintain those protocols, because they are not just rituals; they are lifesavers. Prabhi ji,
Absolutely.
what is your take on that?
See, I totally agree with Mr. Bhutta that post COVID, again, the moment you complete your 17 days, of course, there's you feel very happy about it that I have crossed that stage. But yes, post COVID, you feel that weakness is very much there. You feel very weak. And as he was mentioning, every other day, very small things, we are very vulnerable now. And we get cold very easily, and these things happen. So I got into exercise very fast. I started taking an online class, and I could realize that I have to get back to exercise. I have to get back to walking and various other meditation, pranayam, all these things I got into, because that kept me positive also, always. And pranayam gave me a lot of strength. Meditation gave me a lot of strength. And I felt that, I took it as a challenge that, again, let me see, doctor said 1 month you have to be very careful. So this 1 month I concentrated on, more work from home, and, uh, planned my routine accordingly, and took adequate rest, whatever he told. I took it like this, that these are the guidelines which has been given to me. Now this is a span of time. I have to just take it up, do it, solve it, and follow what my doctor says, and just get going. That is, I took it like that. And I gradually, you'll see you are recovering. And if you have any problems, discuss with your doctor. I had BP issues post COVID, suddenly, BP fluctuations, etc. So I took it up, went to the doctor, and I whatever he said, I followed that, and gradually got back. So this is how we have to see. We got this disease. Now we have to take it up. We have to just take this challenge, and we have to follow this and get over it. This is the only. Follow proper diet, follow, we have to be maintain those restrictions, and rest, whatever you feel like. Try to keep your mind very positive, and gradually you'll get over it. And going back to something which I keep on telling people who haven't had COVID till now, that what if you remember, Rakesh ji, Dr. Roy came in one of the webinars and he'd mentioned that you have to be very careful touching your face. So whenever I had a very bad habit, and I feel that's how I got COVID. I always used to rub my eyes, both the eyes. Always I had a habit. So
Right.
every time we do that, we must be very careful that we should wash our hand and do that. Otherwise, it cannot come in without, your if you don't touch your face, it cannot. And if you're wearing mask, taking proper protection, again,
Right.
we are far, far behind attaining herd immunity. So many of us definitely will be. I mean, a lot of people will be having COVID sooner or later till the
Right.
vaccine comes. But I feel that people who haven't had should be very careful in touching their face wherever they go. They should wear the right kind of mask, which and there was a lot of controversy. If you see, even doctors are learning at every
Right.
stage. So
Right.
the right kind of mask, I was told that these are the surgical mask 3 layer, which you get, 10 rupees or 20 rupees available. Those are the disposable ones. Those are the most effective because you have 3 layers over there. So,
Right.
instead of getting into fashion and wearing fashionable masks, we should wear the right kind of mask. That is my
That's
message.
very,
And
very important.
very, very important, wearing the right kind of mask, so that we don't get affected, and we shouldn't touch our face without sanitization is good, but nothing compared to washing your hands. So I feel even in your car you should carry soap and water with you. And if you really feel like touching something, should wash your hands and touch. This is something which Dr. Roy Alok Roy had mentioned in one of the webinars, and I have seen people following that very strictly, and still they are doing a lot of work and rotary, getting into the field, but following the mask and these things, and got they are fine now. So we need to take precautions, you see. And even now, post COVID, as he said, we can get it again after 6 months or so. So we have to be very, very, we need to take precautions. We need to be careful and learn out of our mistakes which we have done earlier, and
Right.
just carry on like that. But I feel life is wonderful, and God gives us strength also. God gives us these kind of disease due to some, maybe I mean, I got it early because I needed some kind of strength or learning out of it. And COVID has really given me a lot of learning, and I take it in a very positive manner. Those learnings were required for me.
And I think that is the spirit and the attitude with each one of you that is common, that has taken you win over that phase of COVID virus prime time of your that phase of infection. Uh, this brings me to a very, very important area to explore with each one of you. There are two things which are related, which Ashokji has also referred to about the role of family. Here, I would like to expand that question at a larger level. One is going through that phase, and then you have already talked about after you recover, your immunity is weak. You need to be cautious, and one needs to be really careful about that. But then after we come back from hospital, there are two kinds of reactions from the society. One is a mature reaction where people are aware and educated and they take it in a stride, and everything is being taken in a natural course. On the other side, a lot of people have, there's a stigma attached. There's a kind of an element of untouchability coming in कि भाई अगर कोविड हो गया है तो उस बिल्डिंग से भी दूर से निकलो और उस घर के पास मत जाओ. That is the kind of fear psychosis that people are having in their mind, and which is kind of as a educated person, as a lay person, I feel which is unnecessary. Caution is good, but then that kind of a myth is not well founded. But I would like your experience and your opinion about it. How do you see that? Did you face that kind of a challenge, and what message you would like to give to the society?
See,
Rakesh,
Amitabh, yeah, Amitabh, The only person, I was there in the home quarantine with my wife, my son, and my servant. So four of us in the house.
Mm-hmm.
No one even dared to go down. Not even down. The servant was supposed to answer. The servant used my toilet in the house.
Mm-hmm.
Okay. The only people who were very helpful were the Darwans. The
Okay.
Darwans call me up every second day, sir. The vegetable vendor has come. So what do you want? You want the aloo, you want the pyaj, and they used to come, ring the bell because they understood COVID is not there on the doorbell, and they used to
Right.
leave it. Trust me, they were the very people who helped me sustain my eating all these days. The Darwans and the caretaker, I am telling you,
Right.
please remember they are the ones who come to help. Number two, I would like to give a small message to people. Always keep a oximeter at home.
Yes.
Always keep a BP meter at home and a sugar meter. See, my doctor had asked me to. Obviously, no doctor would have come home, but he told me you can give me a call n number of times. But every morning, evening, I want your sugar. What is your sugar? What is your BP? And what is your oxygen? He used to keep a tab, and I used to take a note. This is a must for every household people.
Okay.
Third mistake, what I've seen people doing is this is a mask. A mask is one. Now what happens? I am safe now. Now what happens after half an hour, maybe 15 minutes, as Sarvani was saying, people have the habit of scratching. What they do is this hand is
Yes.
already infected. It's already infected. I am infecting it further by putting it here.
Right.
Please do not, because your hand is touching somewhere, so you think, I am wearing a mask, I am safe. You're not safe because you're touching it again. And even if the virus is not there, you're putting the virus here. So all these small things we do not understand, but we must understand that this should be a daily habit now. A small, like she said, a small bottle of sanitizer in the car is a must. But carry it
Right.
with you. Don't leave it in the car. Don't leave it in the car.
Right.
It's dangerous.
Right.
And don't go out and eat anywhere and everywhere. Don't do that. Even the bread which comes to my house, what I do is someone holds the bread packet, someone cuts it, then I cut it, and then we roll it out. And the packet is thrown as if it's very infected. We take it that it is
Right.
infected. So all these precautions we have to take. The vegetables which come, you wash it properly with running water, and ultimately you're going to cook and have it.
Maybe sodium bicarbonate.
Yes, there are a lot of the liquids out in the market now.
Right.
But I just pray. The only thing is, people must understand one thing is there is some power behind us, with us. Pray to that power. He will safeguard us. Respect that.
Absolutely.
Respect that power. That is all I would say. Respect that power. That can be in any form, but it does. And please stop drinking. Stop smoking. Touch wood, if you get something, the first thing which is there, it is because of your smoke, you get into your lungs. And secondly, drinking is going to destroy your immune system. So these two things is a must. Cigarette smoking, stop it, or maybe reduce it to the great extent, and forget drinking. Let COVID go and then keep on drinking after that. That's all.
Right.
Thank you so much.
Right. That's very, very important. Srabniji, what is your opinion about this myth? That people feel that if in any house or a building you hear someone is infected, maintain distance, and that is kind of creating, even after 2 months of somebody having suffered from COVID, people are still being cautious. So, did you face any such thing, and what is your experience?
Yes, it's true that I faced. Yes, there are people who thought that she had COVID after a month. Also, it's better not to go there or go nearby. That I have seen in some reason or the other. They were not very explicit about it, but I could make out. However, I feel that in my I have been to. I have heard from doctors, and I read a lot regarding this. I follow I discuss with the doctors, with the people, I mean, the COVID doctors who really take care of COVID patients day in and day out and doing a lot of research that post 10th day, a COVID patient doesn't infect another patient. And in many hospitals, they are releasing patients after, if patient is fairly doing good, they are releasing after 10th day. So that is something, I feel that, and you see, if you see a COVID patient, you can't get COVID. It doesn't come
COVID.
through the air.
Right.
People
Absolutely.
have that misconception till date, that
Right.
probably if they see out of the window next door neighbor, you'll get COVID. This is an
Right.
idea which people have. Now, I feel that COVID affected people have to be responsible also. Like I was, my family, in fact, my driver, my office peon, he said, I'm going to come and give you service. We are not bothered. I made it a point that I should not infect anyone in the house. And I said, no one is going to enter this flat. And I put a trolley outside, you put my food over there and thermocol plates and all. And, I'll take it, but no one would enter the apartment. I made it very, very, I told my husband also, he would say nothing will happen. I said, no, you're not going to come in. And, I haven't infected anyone in the house. I have parents, my father is 86, my mother is 76. I was very scared, but they were in a different apartment. But, I haven't infected anyone. So one has to be responsible enough. I agree. But that social taboo that if you see a COVID patient, you'll get COVID, it doesn't happen. So, so that people have to come out of it. They have to understand what it is. See, the doctors wearing PP suit day in and day out, they are serving the healthcare patients, if healthcare staff, how they're, I have a friend who's in Medica. Her mother was affected. She took enough precaution and she took care of her mom. She didn't get
Right.
COVID. She didn't
Right.
get COVID. I
Right.
agree. It depends on individual immune system. It depends on a lot of things. Now, one thing I'll say, I don't know whether it's for that or what we got. I had very little symptoms. We all had. I don't know. I had lot of faith in those karas, having lot of turmeric with pepper and ginger, etc. And we used to have entire family and I don't know whether it's for that or not. And post COVID, all my blood reports and all were, by God's grace, it was fine. I have a feeling that maybe that Kara gave me some kind of immunity which I had. So I feel all these precautions, whatever we have faith in. If you don't have faith, you don't take. That whatever we have faith in, we should just follow, try and take precautions. And above all, I agree with Mr. Bhatia that God is there. And I think this power saves us somewhere, and somewhere, He gives this and He also gives us strength to recover
Absolutely.
and to get over
Absolutely.
it. So we need to have
Ashokji,
faith.
how would you like to interpret people's perception and the social perception, the way people are reacting, your voice about?
Certainly, Amitabh, we are almost 1 year into the COVID.
Right.
In India, it may be say 10 months or so. People have matured, societies have matured.
Right.
Exceptions are always there, but people have learned that if a person has been infected with COVID, he gets treated and comes back home. It's not that he is devoid of the infection or he cannot spread infection, but they are mature enough to go and meet him, maintain the distance, wear the mask, wash the hands, and things like that. People are meeting now. It's not that that taboo is still there. We are a
Right.
mature society now.
Absolutely.
That's it.
And,
Mhm.
and, and I would just like to go and reiterate there that post COVID phase, when Ashokji allowed people to go to his house, I went to his house, had a cup of tea, and it's been almost a month and absolutely fine. So, so
Lucky
that's
boy.
just if any endorsement on that is required. Uh, Prince, the way you are talking, I would like to further emphasize and say that even the doctors who are treating, who are the frontliners, the police officers who are the frontliners, I'm sure many of them have been affected and infected, and they have gone through the treatment and the cure, and they are now back again on duty, helping other who are suffering. So if doctors are back on duty, others will have to understand that the medical science says nothing to worry about, because you can be socially connected with caution till we get the vaccine and the medication. Uh, I would like to my salute to each one of you for braving this social myth, because even coming on a web channel to share and I was apprehensive when I decided that I'm going to do a series and invite people to come to us, whether people will agree to go public about it or not, because of the social myth. But then I now know why you're so successful in your family life, your professional life, and why you are a COVID winner, because you have just the right attitude and the spirit in place. As our theme today is COVID-19 virus, fight it, don't fear it. I don't know whether it is good enough to put it in a humor in this context or not, but still I would take a dare to do that. Jo dar gaya, samjho mar gaya.
वो अपने घर
Because
गया.
even in COVID, you need to maintain your calmness to allow the medical science to take its own course. You need to have that optimism, because और जैसे ही आप डरोगे, आपका immune, there is a psychosomatic effect. I can tell you as a psychologist that
It is.
your body hormones will, its natural secretion will be affected under stress and anxiety that you will have, and that will affect your immune system. So at least one thing you have in your hand, allow your juices to be normally secreted, because your body is equipped to fight the corona if there is a necessary immunity. Sabniji, you wanted to say something?
Amitabh ji, you are very right, because before I had COVID, I was very, very scared. And when I went out for shooting, I had my full crew. Nobody got it. I got it because I was very scared. So somewhere I feel that that kind of fear, actually, if you are very, very scared and afraid, and there's a psychosomatic reason for getting it. And I have I believe in it, that I think I was very scared more than anyone else, and I was the only one to get it.
And I would like to publicly announce, just before COVID lockdown was declared in the month of March, I got my body tested, and my sugar was about 270, and I was first time diagnosed with sugar. And that is when the COVID was announced, comorbidity was announced. And in the last 6 months, I've lost 10 kg weight, and my sugar is absolutely normal.
Excellent.
I just got it checked.
You deserve a big
that
hand.
is all about mind. That is all about optimism. That's all about, as Rakesh ji was saying, take due care. सिगरेट मत पियो, अल्कोहल को हाथ मत लगाओ, वो चीजें जो आपकी इम्यूनिटी को अफेक्ट करती हैं. अशोक जी ने कहा, न्यूट्रिशन plays a very important role, and the family support and keeping that environment of positivity around is a very, very important, plays a very important role. So having said this, we are towards the closure of our session today, and I would like each one of you your final word with a word in our episode today, which is themed COVID-19 virus, fight it, don't fear it. I would like to begin with Shrapni ji, your message to the world.
As I mentioned, that I would that don't get scared. You have to be very, very careful. You have to take all kinds of precaution when it comes, if it comes at all. God forbid it doesn't come, but if it comes at all, take it totally. I mean, just face it and get over it. That's it. Just don't get scared. Don't panic. You have to remain calm. You have to remain. You just take it, whatever is required. Do the tests. And another thing I always say, that don't be afraid of testing. Also, please do the test on time. I don't know, these days I hear a lot of doctors also saying, no, you don't have to test, but I don't know. You should go and get yourself tested on time, and then just face it, and just get over it. Follow the norms, precautions, take medicines, be happy. I know there will be a lot of fear associated with COVID, but just face it and get over it. That's it.
Fantastic. Face it and get over with it. Rakesh bhai, your word with a word for your
I
final words in this episode.
I would request all, please love the COVID patients. You don't have to be near them. If anyone is if you hear anyone suffering from COVID, or maybe he's sick, give him a call. Give him the encouragement. Yeah, theek ho jayega, there's no problem. All they require is a few good words. Don't start asking me what happened, why happened. Please give him strength over the phone. Give each phone call of yours is a fantastic dose of medicine. This is all. Give
Totally,
them
I
love.
agree.
That's nothing more than that they require.
Absolutely. Thank you so much. Love the COVID patient. You need not to go and touch them, but you can touch them with your emotions. You can touch them with their feelings. You can touch them with your helping hand, and that is
Even
all
the
that they
doctors,
require.
Amitabh ji, even the doctors,
Right.
the kind of support and motivation I got from the doctors, that helped me to recover very fast. That word of encouragement and motivation from the doctor who's treating you is very important also.
Absolutely. Absolutely. Ashok ji, your final word with the word in our today's episode. It seems that there's a signal issue with the Ashok ji. Uh, all right. While we are waiting for him to rejoin, I would like to reach out. Friends, please note down our email ID. Our email ID is info@theschooltimes.in. Also, you can write to us on info@hlsindia.org. You can connect to our webpage www.theschooltimes.in, and you can send your details to us. If any one of you who have gone through an experience and a challenge in life, primarily COVID, because that is our priority at the moment to give the right experience, and you want to share your experience on our show to give that hope to people, you're most welcome to reach out to us, because we are going to do few more episodes, even bringing some families and Sravni ji, Rakesh bhai, Ashok ji. We will be connecting back for our other episodes, maybe when we bring in the families together to get the family perspective while people go through the phase. I hope I'll get the same support as I got from you today. Uh, we we would. Ashok ji is
Thank you
not
so much,
there, but then I would like to say that what he shared, he was very particular about a few hours. Okay, he's joined back, so let us take him up with us for his final word with the word. Ashok ji, thank you for joining us back. The technological glitch was there.
Actually, uh, so you want my final word on the thing?
Your final
I
word
can
with
tell
the
you
word.
one thing. Yeah. I can tell you one thing. I can assure you one thing. The COVID vaccine is around the corner. So once it is launched, please hold on to your, please hold on. Don't give it up. The COVID vaccine is around the corner. Everybody will be treated. Don't worry. Keep that optimism on.
Fantastic.
Thank you.
fantastic.
वैक्सीन इज अराउंड द कॉर्नर. जब आपने इतने दिन मैनेज किया है तो कुछ दिन की और बात है. आई नो दैट कोविड फटीग इज क्रीपिंग इन. पीपल आर कमिंग विद दैट एटीट्यूड कि अरे भाई बहुत हो गया, अब सबको होना ही है तो चलो थोड़ा बाहर निकल लेते हैं. Stay cautious still, because it is round the corner, but it is yet to come. तो ये जो कहीं ऐसा ना हो कि क्रिकेट पिच पे आप रन में थोड़ा सा बैट सही जगह ना रखें और आखिरी मिनट पर आप शॉर्ट रन की वजह से you lose the game. So you are right there, and vaccine is around the corner. Keep your hope. Yes, Rakesh bhai.
Amitabh, let me tell you something. Ashok Bhuta, the day I was announced as COVID patient, just
Yeah.
2 days back, just 48 hours back, on front.
Mhm.
I was there with him.
Mhm.
Okay, we had 6 feet of distance, and I was there in his place for half an hour, had a cup of coffee with 2 biscuits, and touch wood, he never got COVID then.
Right.
So COVID doesn't, even if you are COVID, it will not come to you unless and until you are very near to it. It is through the
Rakesh,
saliva,
Rakesh,
etc.
Rakesh, I would like to,
or you
I,
put your
I would like,
hand on it.
yeah, excuse me. I would
Yes,
like
yes,
to clarify here. I would like to clarify here that the nature of this virus is not known to anybody. Even the
Yes.
guys who are doing the research on the vaccine, they are actually playing tennis with a cricket ball.
Absolutely.
Cricket ball.
You understand?
Totally agree.
They're playing tennis with a cricket ball. How can you win it? But still, you see, the entire world is trying. Let us keep our optimism on. ठीक है, बाकी सब ठीक हो जाएगा आस्ते आस्ते.
और बाकी सब ठीक हो जाएगा, and that is the spirit that we have to have. Friends, fight it, don't fear it, because we all have to face it. COVID vaccine is around the corner. Don't give up now. I know all of us are COVID fatigued, but then let's maintain patience. इतने दिन का patience maintain किया है, just about few more months and few more days, and we will be all fine. Having said that, thank you so much, Sabani
you,
ji,
Rakesh.
Ashok ji, Rakesh ji, for being with us today.
Thank you.
Thank you.
Thank you. Thank you. It was a pleasure.
Friends, all of you, 2 gaj duri hai zaruri. Mask, don't take it lightly. Your immune system is important. Your nutrition is important. Love COVID patient. They need your care. Even if you're not at 1 feet distance, it doesn't matter. But they need your emotional and moral support. They need your love and care and affection. Stay connected to them. You don't touch them. And having said this, we'll keep on meeting. We'll bring in more episodes of The Word with a Word, specifically on COVID as well. So stay tuned and keep watching The School Times.
Thank you. Thank you. Thank you.
Thank you.